Eastern Cape has been identified as a COVID-19 hotspot. Gift of the Givers is today opening an isolation wing at Settlers Hospital in Makhanda. The 750,000 rand high care facility has 20 beds and oxygen points. The organization says the aim is to equip outlying hospitals. Let's find out more now. We're joined by founder Dr. eNCA. Doc, a very good morning and thanks so much for your time. So this wing being opened in just a little while there, just give us more idea of what it actually provides.
Morning, Eureka. Right now, as the virus counts are climbing in the Eastern Cape, as you rightly mentioned, the pressure has been on central hospitals like Livingston and the Nelson Mandela Bay Metro. Now that poses a problem. When ambulances coming to those areas from all over the different districts, you find sometimes there's beds, but there's not enough staff to maintain those beds, or they run out of oxygen, or they have difficulty in getting oxygen in time. And more importantly than that, the staff are getting exhausted because the patient count in the district is rising, then patient counts are coming from outside, and then some of the medical staff who get quarantined, who get ill, and they get affected, it means we have less staff. So by decentralizing, like what we're trying to do and are doing, the medical staff in outlying districts then should look after the patients themselves. And then there's no need to transfer those patients to Nelson Mandela Bay Metro or other big centralized hospitals. And that's exactly what we've done. And we've only achieved it because the CEOs and hospital management agree with the system. That means they are prepared to take in more COVID patients, even the critically ill ones, and look after them, even though they themselves are short-staffed in these areas. And in Settlers, we were here last week, we saw a section of the hospital not being used. And we said, why is this lying like this? They said it belonged to a private hospital. They left a few months ago. They took their things away, and we couldn't do anything. So we stepped in, and within 5 days, we renovated the wing, putting in 20 beds, and we're opening it today. Yeah. And it's not only the hospital. The entire town is excited.
So, Doc, what is the agreement you actually have? Because you've obviously got to coordinate with the health department there and other organizations or other bodies that are actually dealing with the spread of COVID-19. How is it going to work? How do you interlink and how do you work together?
No, it's straightforward. We're just handing it over to the hospital itself. It fits under their management. The hospital CEO has the authority over the hospital itself. The hospital CEO decides. She said she wants a wing. We did it for her. We put the beds in. We've been supporting them with PPEs, scrubs, pulse oximeters, non-contact thermometers, and a whole range of other things. So it just fits into the existing system within the hospital. There's no complication. They run it with their own staff. They just get more patients in instead of them lying outside in casualty or waiting somewhere. Like in some areas, patients have been sent to bed and breakfast because there's no place in hospital. And those are other areas which we're trying to assist also, to take the pressure off the hospital, but not sending people to bed and breakfast, putting up in extra facilities within the hospital.
And will you be able to sustain this support for this particular wing, for this facility?
Yes, because there's not much for us to do. They put it into the normal system where they use their own staff, they will get the oxygen. They may require additional equipment, which we in any case have been making available to hospitals throughout the country. PPEs we supply to 200 health facilities nationwide, so we can still support that. Oxygen machines, oxygen gadgets like flow meters, gauges, interconnectors, all those kind of things they require, we can support them. So we've been constant in our support since the 11th of March, even before the 15th, and we've been supplying. But what we do, we target those areas which are the hotspots, which have a high number of patients, and in the process, what has been forgotten are the smaller outlying hospitals. Yeah. We found that support may come for the big hospitals from other donors, but the small one nobody considers. And we've been focusing a lot on the small hospitals, and you can see the impact. They are really, really in distress. So you look after those hospitals, we can look after Settlers. Whatever we've done is measured. We're not putting in something that we can't support later on.
All right, great work as usual. Thanks very much. The gift of the givers, Dr. eNCA.